Good evening, and thank you for joining our webinar series. My name is Cara Harrington. I'm Reception Manager at Little Bushey Surgery, and I'll be co-hosting this webinar today with Inez Rivera de Assis, who is a member of the Little Bushey Surgery Patient Participation Group. Over the next hour, we'll be learning about perimenopause and menopause and how lifestyle and nutrition changes should help towards improving symptoms. We're very lucky to have with us Dr. Nitu Bajakal, MD and Senior Consultant Obstetrician and Gynecologist in London, with nearly 40 years of clinical experience in women's health. Her extensive career has made her a leading expert in lifestyle medicine, menopause, PCOS, endometriosis, and period problems. She is a keyhole surgeon with experience in laparoscopic procedures, including robotics, a fellow of the Royal College, and one of the first board-certified lifestyle medicine physicians in the UK. She is also the author and co-author of several books about menopause, perimenopause, lifestyle and hormone therapy, which are available now, and she has an extensive website with free fact sheets on various women's health issues and on lifestyle medicine. Inez will briefly provide you details of her website and social handles in the comments should you wish to read more information, access her free fact sheets, or follow Dr. Bajakal on Instagram or TikTok. Before I hand over to Dr. Bajakal, there are just a couple of things I would like to make sure you're aware of so you can make the most of this webinar. At the end of the webinar, we will open a session to answer any questions. To speed things up, please feel free to post them in the chat box at the bottom of the screen or via the Q&A section next to it. And if you miss this webinar or have to leave early, do not worry. We'll be recording this session and make it available via our Little Bushey website, where you'll also be able to follow and subscribe to future webinars on other topics. Now, and if everyone's ready, let's get started. Over to you, Dr. Nitu Bajakal.
Good evening to everybody. I really appreciate each one of you taking the time out at 7 in the evening when you should be unwinding. So I hope that you will find what I have to say useful and will give you food for thought. And you don't need to really take notes. This recording will be there for you all on the website of the surgery, but also I have a free website with at least 50 different fact sheets, www.nitubajakal.com, which you can access, and you can read on many, many topics, including information on perimenopause, menopause, and lifestyle medicine, as well as surgical procedures such as hysterectomy and heavy periods and all kinds of things. So please relax and think of questions that you want to ask me, but also hopefully we'll have a very good session that you will take away a lot from. So, doesn't seem to want to move, Jeff. So, okay, no problem. I think because people are entering, there is. So just to give you a little bit of context, 1.2 billion women, and we are, the world has about 8 billion people. 1.2 billion women will be menopausal in the next 6 years globally. That is a quarter of the world's female population. And what we have to remember is of those, at least 13 million are going through menopause in the UK itself. And nowadays, given the retirement ages, 8 out of 10 menopausal people are at work. And 1 in 4 of them experience such severe symptoms that they often may have to leave their job. And there are many factors, social, cultural, biological factors that affect the experience of menopause. And I'm not going to go into those in detail, but you can see at the top corner my latest book on menopause and perimenopause, where I dive into various aspects that can affect our menopausal experience. Interestingly, even female doctors are not exempt, and British Medical Association survey of 2,000 women doctors showed that a huge number of women, 90%, said it impacted their working lives and they didn't get the help that they needed. a similar story all over the world, including the US, and I've just put up a few snapshots. But the Fawcett report was particularly eye-opening. 1 in 10 women left their job due to their symptoms. 8 out of 10 women said their employer hadn't shared information, hadn't trained staff, or hadn't put into place anything to do with menopause or menopause absence. In fact, half the women don't approach their doctors because they feel that they are not going to be heard. And 3 in 10 find that there are delays in diagnosis because, as you are all aware, GPs are overworked and they don't often have the time, and same situation in hospitals as well. So it's quite a dire situation where people are not feeling heard and are actually going through symptoms without the help that should be available to them. And only 4 in 10 women were offered hormone replacement therapy where they were suitable for it at the right time. So Sarah is a 46-year-old woman. She says she has increased menstrual frequency, which means her periods are coming a little bit more crowded together. She used to have 28-day cycles. Now she has 24, 25-day cycles, and she's skipped some periods in the last few months. She's also been noticing panic attacks and occasional hot flushes and reduced sex drive. Then her symptoms seem to improve and she starts thinking it is all in her head. And then the whole situation starts again. So what do you think is happening here? Most likely, after taking a detailed history, Sarah is actually going through what is known as menopause in transition, or perimenopause, which means that her hormones are leading into menopause, and this can start anywhere from 2 to 8 years before stopping periods completely. So you can imagine if somebody is destined to stop their periods at the age of 46, their perimenopause in some women may start as early as in their late 30s, sometimes even before they've started thinking about having a family. But the average age of perimenopause in the UK and generally around the world tends to be around 47 years of age. In the Asian countries like India, Bangladesh, women actually go through menopause much earlier, around the age of 45 and 46. So they may have experienced perimenopausal symptoms in their early 40s or late 30s. And why does perimenopause occur? Now, on the left side, you can see that there is a whole diagram of the menstrual cycle. And again, I discussed this in both my books. But also there are hormones. Hormones are chemical messengers, and they basically work their magic on organs at distant places. For example, the brain releases thyroid um, uh, releasing hormone, which works on the thyroid gland, which is a butterfly-shaped gland, to release thyroid hormones. Same way, the brain works on the distant organs such as the ovaries to produce estrogen and progesterone and testosterone. So what happens is one is born with the number of eggs at the time of birth, and you may be born with about 1 million eggs, and by the time you hit 30, they've gone down to a few 100,000, and by the time you hit 40, there are only about 100,000. You need only about 300 eggs in your entire life because of the menstrual cycles. But not just one egg gets released every month. There are about another 100 or 1,000 eggs that never make it and actually just disintegrate. So the ovaries start to fail because the number of eggs in the ovaries reach a critical point, and as the number of eggs in the ovaries drop, the hormone levels start fluctuating, periods start becoming irregular, and women may notice symptoms of hot flashes, mood and sleep changes, and vaginal dryness, and migraines, and breast pain. And even in your late 30s and early 40s, the bone starts getting weaker, and there are changes in one's cholesterol and blood sugar. So perimenopause should not be taken lightly, because although you may be having periods, or you may be skipping periods, if your periods are heavy, if you're finding that you're having any of these symptoms, don't ignore it, because it is important to seek help so you actually understand what is going through your body. And that is the reason why my website is there, to try and help educate women and empower themselves. So what happens is the average age of perimenopause is around 47 years, tends to last about 2 to 4 years. In some women, it can last 8 years or so. Some women, it'll last only a year. But that then, as the ovaries keep failing, the estrogen levels drop, and the number of sorry, please mute yourself. So as the ovaries start losing all their eggs, it drops to something like just 1,000 eggs in an ovary and periods completely stop. This is a natural menopause and it's a retrospective diagnosis. That means there are no periods for 12 months. So after you've not had periods for 12 months, you look back and say, I've gone through my menopause, but you never finish with menopause. You're always in the menopause from the day you have 12 months of no periods until the day we die. So people often say, I've been through it. I don't need to worry about it. I don't need to read your book, Mrs. Bajikal. I don't need to go on your website. No, you always will be in menopause, and there are different symptoms that can affect people. Early postmenopause symptoms are different versus late after 5-6 years when the bone changes and the lipid changes and the heart effects and the joint effects become more pronounced. So it's really important to empower yourself earlier. The average age of menopause in the UK is about 51 years. But as I said, people from the Asian subcontinent stop their periods around 45, 46, but the range can be anywhere between 45 and 55. And one doesn't really know when one's periods are going to stop because there are no real tests. But we know that estrogen levels fall, and that's responsible for many of the symptoms, and the brain starts producing more of the follicular stimulating hormone, telling the ovaries, buck up, start doing some more work, release more eggs, but it doesn't, at some point, stops failing. And so that's when menopause hits. But there are certain predictors. So if you are, as I said, from the Asian subcontinent, if you're somebody who smokes tobacco, if you do lots of night shifts for years and years, your diet and your genetics when your mother went through menopause, all these can affect how and when you have and stop your periods. So this is a menopause where no periods after 12 months. Perimenopause is the lead up to menopause and can last anywhere between 2 to 8 years. The average age of menopause is between 45 and 55. There are several symptoms, and you would have read a lot recently. The papers tend to be full of it. But there are some symptoms that are more common and some that are not that common. And it doesn't mean that most women will go through all the symptoms. But hot flashes tend to be the most common symptoms. Night sweats are a variant. Women may say they can't concentrate, they can't remember things, they have reduced sex drive, sex may be painful, vaginal dryness may be a problem, especially in the few years after periods have stopped. Sleep can get disturbed and then can get better, mood changes, tiredness, bladder and bowel symptoms, joint pains, gum issues, feeling of ants crawling under your skin. All kinds of symptoms can occur. Women may struggle to lose weight. But as I said, most women may experience a few symptoms, and some women may experience no symptoms at all. And some of them, I'm so sorry, I'm struggling with a bad cough and cold in the last couple of days. So the other symptoms that women may notice are joint pains, hair loss, excess facial hair as the testosterone and estrogen levels get out of sync, long-term problems of heart disease, bone loss, skin changes, balance issues, and osteoarthritis can also be real issues. So there are lots and lots of different symptoms, but this is not to scare. This is for you to be aware so that doctors can join the dots rather than treating you separately for different conditions when actually you need management for menopause. But it's also important to be aware that not everything is because of menopause. And so as health professionals and as the person who's going through symptoms, it is important to, not always assume that this is because of menopause, and also wrong to assume that this is not because of menopause, that you're too young for it. Because as I said, age can be very variable as early as 45. And of course, you have a whole group of women under the age of 40 where periods may stop. And I'll come to that in a second. The commonest symptom of menopause tends to be hot flushes. 8 out of 10 women suffer, but only 2 to 3 women out of 10 seek help. 50% of women will continue to have hot flushes after 4 years, although most people will find that their hot flushes actually disappear. But unfortunately, 1 in 10 women will still find that 12 years down the line, they're still suffering from hot flashes. And we are very unclear as to what is the exact cause. It may be because of estrogen, because we know HRT does help with hot flashes, but there are several mechanisms by which it can work. And usually women will say that they have anywhere between 1 per day to several hundred a day, and they may have a warm sensation. And in hot countries, they may actually have what are known as cold flashes, and sweating and palpitations and being left feeling really cold afterwards is not unusual at all after that initial heat. But it's important also to be aware that there are other conditions and some medications that can cause hot flashes. So your doctor needs to be aware of other conditions as well. How do we diagnose it? Is really shocking. The number of patients come to me having gone, asked their doctor, GP, to do some blood tests, and correctly the doctor says, no, there are no blood tests to be tested after the age of 45 if the clinical diagnosis is very clear. You've stopped your periods for a year, you are having the clinical symptoms. They will then suggest that you have tests for your iron levels, your cholesterol levels, and check your blood pressure, but they will not do hormone tests because there's actually no point doing hormonal blood tests after the age of 45. Between the ages of 40 and 45 and under the age of 40 is a whole different situation, and one has to entertain diagnosis like early menopause, which affects 12 out of 100 women. And under the age of 40, 1 in 100 women will stop their periods with the condition known as premature ovarian insufficiency. I myself went through this at 38, and it was a real struggle to get heard. So it's important that these are specialized situations, and your doctor should refer you to a specialist. But after the age of 45, please do not ask for hormonal blood tests because they are not going to be helpful. Instead, ask for tests to check your thyroid, your full blood count, your blood sugar, your blood pressure. Those things are more important. And heart health and bone health is especially important if you stop your periods early. So Usha is a 48-year-old woman who has noticed that her periods are coming now more often. She has some night sweats, lowered mood. Her periods are not heavy. She's struggling with her weight. So she's perimenopausal. She has a sister and an aunt with breast cancer, and they are BRCA negative, so they don't have the genetic condition. She wishes to avoid HRT for now and wants to know how she can help herself. So this is where I spend quite a lot of time because people need to know that whether you take hormone replacement therapy or not, which is safe for the vast majority of women, lifestyle is really important because that's what's going to hold your hand from the cradle to the grave. So the earlier you bring in changes that will improve lifestyle, it is better for you, but it's never too early and never too late to make changes to improve your health. So what is lifestyle medicine? Lifestyle medicine is not functional medicine. It is not alternative medicine. It is actually a scientific specialty which uses evidence, it uses research, lifestyle therapeutic approaches to treat and prevent, and in some situations, reverse lifestyle related chronic diseases such as type 2 diabetes, heart disease, and reduce the risk of certain cancers. But it's important to understand that lifestyle medicine runs alongside Western medicine, which means that just because you're going through menopause, you want to do lifestyle, that's great. But if your quality of life is suffering and you're doing all the things that you can do to the best of your ability, you are somebody who will benefit from hormone replacement therapy. So it's not that it's one or the other, but lifestyle is really key. And I want to try and take you through the 6 pillars of lifestyle medicine. But the difference between Western medicine and lifestyle medicine is that Western medicine, your doctor or the health professional is in the driving seat. While in lifestyle medicine, you are in the driving seat. You as the patient is in the driving seat because self-care and self-management and self-discipline, that's what we are looking at. You are the person who's going to decide how much of lifestyle changes you want to bring about, because the science is clear that we can use lifestyle medicine to actually improve our quality of life and reduce so many lifestyle related chronic diseases. And I discuss this in more detail on my website as well. So what are the 6 pillars of lifestyle medicine and how do they apply to perimenopause and menopause? The first is the food that we eat. So predominantly you should be choosing foods that are coming from whole plants. And I'll discuss that in some detail. The next lifestyle pillar is ensuring that you get regular physical activity, you get good sleep, and sleep can be a real problem in perimenopause and menopause for a number of reasons as your hormone levels fluctuate. You need to find ways of managing your stress because everybody does have stress, but you need to find ways so that you don't, so you avoid your blood pressure from going up, your cortisol levels from going up, and your hormones going all over the place. So that's the 4th lifestyle pillar. The 5th lifestyle pillar is finding a way of avoiding risky substances because alcohol and smoking now, at least has got quite a bad press, but alcohol is still considered a social activity, and the number of people who are overusing alcohol is quite high and comes with many risks. In fact, I'll talk about alcohol in a minute. And the last lifestyle pillar is positive social network and building friends and community and giving back. All these things make a big difference to the quality of one's life. And these are all based on science and on research and on all studies and by observing various societies. So this is not something that is my viewpoint or is my opinion. These are based on lots of studies, which you can go on to the American College of Lifestyle Medicine, as well as on my website, and you will read these various things that we have discussed. So the first thing that I want to talk about is looking at lifestyle and diet. Now, unhealthy diets are responsible now for 1 in 4 deaths all over the world, with 11 million deaths in total, making this a leading risk factor. And this is from the most reputed journal, a study by the Lancet. 60% of the British diet now consists of ultra-processed foods and drink, and consumers remain very confused because the media and the industry is hell-bent on confusing the public, because 80% of people report that they find information about food and nutrition very confusing, because one day they read that, butter is great for you, the next minute they read that butter is really bad for you. And 60% say that conflicting information makes them doubt their choices, which is the exact purpose of these industries, so that you go back to your eating habits. And everybody loves to hear good things about their bad habits. So what are the foods that you should be eating to try and avoid the epidemic or the pandemic all over the world? 70% of the British population are either carrying excess weight or are obese, with many of them being morbidly obese.
Well, you started dealing with someone else, isn't it?
Sorry?
Yeah, but then you...
Okay. So if you can hold your questions till the end, yeah? So obesity and being overweight affects now 70% of the UK population, especially women, and especially women in their 50s and 60s. Why is this? Because of a combination of the foods that we choose, a sedentary lifestyle, sitting is the new smoking, and also carrying excess weight is closely linked to a number of cancers, including female cancers such as ovarian cancer and womb cancer and postmenopausal breast cancer. It also has a very negative impact on the higher incidence of hot flashes, type 2 diabetes, high blood pressure, dementia, and a risk of certain cancers, and of course makes pregnancy a higher risk situation. So as a result, it's quite not surprising that in August 2022, that of the 10 leading causes of death, dementia now is the top cause of death for women in the UK, with heart disease and cancers. In fact, most of the 10 leading causes are lifestyle related. So other than a couple of infections, almost all of them we can do a lot about to try and reduce our risks. And how do we know that? I don't know how many of you have heard about blue zones. Blue zones are the 5 places in the world where people live the longest and the healthiest, and they range from the Seventh-day Adventists in California to the Okinawan Islands in Japan, which I had the good fortune of visiting in March, Sardinia, Nicoya, Ikaria, and Loma Linda itself. And the wonderful thing that when there was Dan Buettner and team researched these groups, they found that 80 to 95% of their calories came from plants. So fruit, vegetables, grains, purple sweet potatoes, corn, pasta, and beans were found in all the blue zone diets, and people were eating beans at least 2 to 3 times a day. So that is really important information to take away. Diet, of course, is not the only reason why they live longest. They also tend to be people who are active, who are outdoors, who have part of a community, who don't really indulge in the risky substances. So it's important to actually take away important things from these groups and see how you can apply it to our own lives. So as I was talking about the first lifestyle pillar, the first lifestyle pillar is trying to have proper nutrition, because it's the key to unlocking your body's potential. And I had the most wonderful meal in Japan, and it was one of the most spectacular holidays with the most delicious foods that one could imagine. So what are the sort of foods that the experts recommend that we should be eating? This is to try and reduce the inflammation in our body, because inflammation is the building block of most chronic conditions, whether it is high blood pressure, whether it is many types of cancer, whether it is type 2 diabetes, whether it is carrying excess weight, or whether it is menopausal or perimenopausal symptoms. And when you eat certain plants, then you find that they behave as antioxidants. They help to nourish the gut microbiome, as well as nourish the estrogen-specific gut microbiome known as the estrobolome. So what should be on your plate? Your plate should have foods that are rich in fiber. There is no fiber in the foods on the right-hand side, or very minimal fiber. No animal food has any fiber, but fruits, vegetables, whole grains, potatoes, sweet potatoes, yam, beans, lentils, peas, soya, herbs and spices, mushrooms, seeds and nuts should form the bulk of your diet. And you should keep foods that lack fiber to a minimum, which include sugar sweetened drinks, fruit juices, refined grains such as cakes and biscuits, and other baked goods, ultra processed foods such as bacon, animal foods, and minimize salt, oil, and sugar. Use them as flavorings, except for the exception of extra virgin olive oil, which should be a good quality. And if you're not struggling with weight, then you can use oil. But remember, 1 tablespoon of olive oil contains, or any oil contains, 120 calories. So if you are trying to lose weight, then reducing the amount of oil in your diet can really make a difference, especially oil comes in takeaways and food from outside. And I have a lot of recipes on my website which actually use minimal or no oil, including in my book. So as I explained, eating a whole food plant-based diet, which is rich in fruits and vegetables and plant proteins, and making water the drink of choice, helps to regulate blood sugar, hormones, reduces inflammation, keeps your cholesterol levels down, helps you to maintain healthy weight, because these foods are naturally low in calorie. Even nuts and seeds are actually beneficial in helping one lose weight. Potatoes and sweet potatoes, unless they are fried, are really very good for you, because they help to keep you full for longer and help you to lose weight in the longer term. And it also helps you to maintain a healthy gut and improves immunity. So where possible, try to make your plate as colorful as possible rather than beige colored foods. And we know that plant-based diets in menopause are particularly helpful. And there have been a number of studies to show that those who eat whole plant foods have fewer menopausal symptoms, their blood pressure improves, they have less hot flashes, especially when they include soya in their diet. They can have dramatic improvement in their hot flashes. There appears to be a positive impact when you eat fruits and vegetables, while in contrast, when you have crisps and cakes and oils, then menopausal symptoms tend to get worse. So try and get your fat and your protein ideally from plants such as vegetables, tofu, nuts, and peanut butter, while saturated fat, mostly found in animal foods and ultra-processed foods, actually increase body weight and worsen menopausal symptoms. And there are a whole bunch of studies, and I've got over 100 references in this area in my book as well. A little bit about soy, because it has such a bad press, but soya is very good for you, for men, for women, for children, whatever gender you may be. But soya is not the only one that contains plant estrogens. Plant estrogens, which are isoflavones and lignans, which help to reduce the risk of breast cancer and heart disease, are found not just in soybeans, but also in chickpeas and beans and berries and raspberries and pistachios and flaxseed. And they behave similar to estrogens, but they're very clever. They actually promote the growth of estrogen in some tissues, and like in the bone, and block the effect in others. And that's known as the SERM effect. And by doing that, it reduces the risk of breast cancer, but reduces the risk also of osteoporosis and strengthens your bones. So really, it's quite a magic bean, and one that I would recommend each one of you, whoever you are listening to this, you should try to include this at least 2 to 4 portions into your diet, not more than that, simply because you'll cut out on other foods that are equally healthy as well. So very few people can be allergic, 3 or 4 people out of 1,000, and most people grow out of that allergy, but really don't listen to common tropes. And I have a whole fact sheet on why men and women should be eating soya on a daily basis. Now, how do they act? I don't think you need to know this slide very well, except to show that soya isoflavones are very clever. They preferentially bind to the beta receptor, while estrogen that comes from dairy and from red meat and from chicken and from your own body fat works on both these. And as a result, soya is able to really work on reducing the risk of breast cancer and ovarian cancer, but promote the heart health and bone health. What is the effect on menopausal symptoms? A beautiful study done in 2021 showed that women, just for 12 weeks, just for 3 months, all they did was have a diet that was plant forward or plant-based. So lots of green leafy vegetables, fruits, vegetables, and whole grains. But they added half a cup of mature soybeans, which is about 55 milligrams of isoflavones, which you can get from a cup of soy milk and a handful of tofu, which should give it to you. They found that the hot flushes reduced by 84%, moderate to severe hot flushes. This is astounding information, and if it was a drug, it would have been snapped up. But you don't want to really take soya isoflavones in the form of a tablet. You want to eat the real thing, because nature is very clever. It knows how to bring all the components together, because soya is not just plant estrogens. Soya is a very good source, even better than eggs, for protein. And eggs, is considered to be one of the best sources of protein, but actually it doesn't have any of the nasties of animal food, but has all the good things, including all the amino acids arranged in the right way as egg white. And of course, it has micronutrients, vitamins, and lots of fiber. So they found also that when they consumed soy in this study, they also found that they reduced something called dietary advanced glycation end products, AGEs. Remember, AGEs age your skin, they age your ovaries, they age your heart, and they come from foods like barbecued chicken or anything that is heated at a very high temperature. While when you eat plant foods such as, say, mushrooms and wild rice, there's a dramatic reduction. When you eat soya, there's a dramatic reduction in dietary ages. So you end up not only looking younger, but your insides also look younger. And there's a reduction in hot flushes as well. So I would recommend that the earlier one can add soya after the age of 1. And before the age of 1, we recommend soy-based formulas with the help of a pediatrician. Or obviously, ideally, breast milk is always the best, but not everybody can nurse, chest feed or breastfeed. But starting soya early in childhood and in early adulthood can reduce the future risk of breast cancer. One portion is what you can hold in your hand. So for a child, is a piece of apple or a couple of pieces of tofu, compared to our hand, which will often have, maybe 8 or 10 pieces of tofu. So it's about 80 grams. So if you're actually looking at grams, it's about 80 grams. That's what a portion is. So even one portion of soya per day can reduce the future risk of breast cancer. It also reduces bowel cancer, lung cancer, prostate cancer, and ovarian cancer. How does it do that? Because it actually stops the new blood vessels from forming in cancer cells. And so that's how it works its magic. And studies have shown repeatedly that people with breast cancer should not be afraid of soya. In fact, the Cancer Research UK will recommend soya. And studies have shown that women who eat soya, once they've had a diagnosis of breast cancer, they actually have the lowest risk of the cancer coming back and die, and a 30% reduction of less chance of dying from breast cancer. Also, soya helps with a slimmer waist, weight loss, heart healthy. It helps with menopausal symptoms and with bone health, reducing the risk of osteoporosis. And unless you're allergic, which is 3 to 4 people out of 1,000, consuming soya products regularly is safe. And I would suggest aiming for 2 to 4 portions a day, such as a cup of soy milk, tofu, tempeh, natto, soy milk, soy yogurt. But you don't want to have gallons of anything, because if you just ate carrots, you would put out a whole lot of other healthy food. So you want to make sure that it's not because it's unsafe, you just want to include lots of those other colors that I mentioned. People often ask me, but what about protein, Mrs. Bajikul? Well, you can see that there is no dearth of good sources of plant protein, which you can meet in all good ways. And so, these are important situations that when people ask you, but I need to eat protein, people often think that protein comes only from animals, but you just have to look around, and the largest animals and the fastest animals are plant-based. So you have the elephant, the hippo, the rhino, the giraffe, they all eat plants and they get enough protein, they're strongest. And the ones who are really quick, and you know that if you've been on a safari, most cheetahs and lionesses will only get the old and the very young or the lame, because even those gazelles and antelopes and deer and wildebeest are all plant-based. So anybody who tells you that you cannot be strong on plant protein is actually doesn't know the science. I would ask you to try and eat in line with your circadian rhythms. So try to get, as soon as you wake up, open the curtains, breathe in some fresh air, and look at any sunlight if it is there outside, which we often don't get. If possible, try and have a little 15-minute outdoor walk rather than walking on a treadmill. And try to have front load your calories. Try to have don't miss breakfast. Have a larger breakfast and a larger lunch rather than a big dinner, because this will help to optimize insulin sensitivity, help you to keep your weight under control. So breakfast like a queen, lunch like a princess, and dinner like a pauper. And try to eat by 7 o'clock, because this will help you to sleep better. And it'll also allow you to do a little bit of intermittent fasting of about 14 to 16 hours. Or you can also bring in some water fasts once a week if you're used to fasting, like I have done for the last 2 or 3 decades. It's also important not to stuff yourself. So hara hashibu is eating to 60 to 80% of fullness, because often we eat because our mouth is feeling hungry rather than we need the food for nourishment. So learn to get up and not overload your plate, and actually enjoy and savor your food and chew your food, and make sure that you're not eating to bursting point. And the good thing about eating plant foods is you almost never feel so full that you're uncomfortable. And you have to try this to actually understand how good it is. This is one of the first things people tell me when they come to my home and I feed them a lovely plant-based meal. So we've talked about the importance of eating plant foods that are minimally processed, mostly whole plant foods, including soya, and eating lots of foods that contain fiber. But there are other lifestyle changes that are important. You can't just have an excellent diet and forget about your sleep or your physical activity, or your stress management, the alcohol and smoking, and positive social networks. So we're going to talk about the other lifestyle pillars now. Why is it so important? Because we know that in perimenopause and menopause, sleep can really get affected as the hormone levels fluctuate. But stress and pain from painful periods, endometriosis, adenomyosis, all these can also affect sleep. So really you have to find a way of building in some sleep hygiene, because this is a time when all the junk is removed from your brain, DNA cell repair occurs, so that you reduce the risk of dementia, you reduce the risk of menopausal symptoms, and try to aim at least for 7 hours. And do make sure that you are switching off from screen time at least an hour or two before. You're moving your body throughout the day. And if you're somebody who has a sitting job, remember that any amount of exercise does not negate sitting for hours. Every 45 minutes to an hour, you should get up, stand up, and move around, do the laundry, or take the dog for a quick walk, or do some squats, do something so that you're actually getting the blood flowing. So it's really important that you do that. Having things like blackout curtains and early evening meal and minimizing caffeine and things can really help as well. Exercise really makes a difference in reducing the risk of many cancers, but also the chance of the cancer coming back. But in menopause, it particularly helps in balancing hormones, improving insulin sensitivity, improving sleep, and improving mood. It also doesn't help in weight loss. So anybody who tells you that you can lose weight with exercise is actually not telling you the whole truth, because you need to exercise like Paula Radcliffe or Usain Bolt to actually lose weight. So what you have to do is it's only through calorie deficit that you can lose weight. And that's why plant-based diets tend to work very well. But keeping weight off, exercise is really helpful. So it's important to incorporate that. And you should try to aim for 30 to 60 minutes per day. And that can include a variety of exercises, but you must find a way of including resistance training or strength training for half an hour, at least twice a week. It's so important to reduce the risk of osteoporosis and sarcopenia, and it's never too late, and it's the earlier children start, the better it is. Whether you do skipping, whether you use ankle weights and wrist weights or lift weights under supervision, it is important because after the age of 30, women start losing bone very rapidly, and after menopause, it's even quicker. Stress, as I said, all of us have stress. So you need to identify what your stress triggers are, because stress can really worsen menopause symptoms and insulin resistance and heart disease. So find ways of reducing your stress, whether it is by talking to a friend on the phone, going for a walk, natural light, meditation, mindfulness. Find things that will help you, whether it's sitting in the car for 5 minutes before you come inside to your home, just doing some breath work. Find ways of reducing your stress, because this will make a big difference to how you experience menopause as well. I cannot stress the importance of having friends, family, community, giving back to society, making sure that you have a life purpose. And that could be anything from looking after your grandchildren or looking after your elderly neighbor or doing a talk like I am doing. Finding ways of giving back to society can make people live much longer and live a happier, more productive life. The last thing we come to are risky substances, and cigarettes, alcohol, bacon, processed meat, asbestos all fall under group 1 carcinogens, which means that they're known to cause cancer. Even eating 50 grams, which is like 1 rasher of bacon, can increase your risk of cancer, colon cancer, by 17%. And eating a small steak can increase your risk of red meat, can increase your risk by about another 10 or 12%. So really, you have to think logically. Should I be eating these foods? And if I'm going to eat them, am I going to limit them so that I'm trying to bring in more plant foods? Because again, these foods, cigarette smoking, alcohol, all these will increase these advanced glycation end products that will age all our tissues and increase our risk of cancers. And don't be fooled. Don't let anybody tell you that alcohol is safe. Every large organization tells you that there is no safe limit of alcohol. So when you do drink that glass of wine, you're drinking it mindfully, probably as a celebration, rather than drinking because you think it's good for your heart. Susan is a 52-year-old woman who has had no periods for a year. She's struggling with hot flushes and disturbed sleep. She has no risk factors, and she wants to consider HRT. So I'm not going to go into details of hormone replacement therapy. I have a whole fact sheet on my website. I have a whole section in my book. So you can read about the fact that HRT is safe for the vast majority of people. People should ideally take HRT around 4 or 5 years, around perimenopause and early years of menopause, which seems to be the most effective. Starting it for the first time after the age of 60 should only be with the help of a specialist and should be very carefully considered because we don't have the studies yet. How long can you take it? Really, after discussion with you, you may wish to take it for, I have 90-year-olds who take it, but generally the recommendation is for as long as you will benefit from the relief of the acute symptoms. And sometimes we will use it for people who may have a family history of osteoporosis and they have clinical symptoms as well. What about HRT in the perimenopause? Yes, there is a role for some people. Testosterone has been hyped quite a lot, and not everybody will benefit from it. It's not licensed yet in the UK. But again, I have a whole discussion and a case study in the book. For those with breast cancer or risk of breast cancer, it's a very specialist discussion and it's not something that I will dive into here. Where do lifestyle changes fit in? As I said, the earlier you start them, and doesn't matter how old you are. My 96-year-old neighbor said that she learned a lot, when I did a talk for them and she read the book. So what types of HRT? Remember that if you still have your uterus, you need both estrogen and progesterone. We start with the lowest dose unless you are under the age of 45 or 40 when we start with a higher dose. That should be with the help of the specialist. Otherwise, your doctor can start you on HRT and you should be assessed in 3 months and then yearly after that. We usually prefer the body identical hormones, not bioidentical, not what you get in the quack pharmacies, but NHS approved body identical hormones which are made from plant-based sources. So things like a gel or a pump or a patch, and micronized progesterone either orally or the Mirena coil. And if you've had a hysterectomy, you just need to be on estrogen alone. And we sometimes then add testosterone as well in some women, especially those who are doing a lot of strength training and who are finding that they're having brain fog or mood changes and libido changes, especially in perimenopause. And sometimes adding a bit of testosterone can help them. But for a lot of women, they don't find much improvement over and above the regular estrogen and progesterone. But it's estrogen that actually gets rid of your hot flushes and your menopausal symptoms. Progesterone is just there for the ride to protect your uterus from cancer. And so all these clinical decisions as to when to stop, how to stop, those sort of discussions I've done both on my website as well as on in the book. I'm not going to spend too much time on this, except to say that some women can't take HRT and some women don't want to take HRT. So that's why, since we are going to stop our periods anywhere between 45 and 55, and we are hopefully going to live life expectancies 83 years in the UK, 88 and 89 years in Hong Kong and Singapore, we want to make sure that you're bringing in lifestyle measures, because you're not going to be taking HRT for 30 years. So you do want to bring these changes in of eating more plant-based foods, moving your body, sleeping well, identifying stress, reducing the risky substances, and building a social network and community. So it's really important. And the risks of breast cancer, stroke, and clots in your legs have been overhyped, which is why it had a bad press 20 years ago. But we now have good data to suggest that the type of HRT we use and the amount of time that we recommend, these risks are negligible, and most women can be absolutely on HRT if they need it for their symptom relief. What are the alternatives? What if you can't take HRT? What if you don't want to take it? We know that there are some very good studies looking at acupuncture, at cognitive behavior therapy for insomnia, meditation, mindfulness, yoga, hypnosis for hot flushes. And in some women, especially those with a history of cancer, we are looking at things like antidepressants and gabapentin. They're still not very effective, and that's why lifestyle is so important to bring in, and especially bringing in soya and minimally processed soya, like I mentioned, soya milk, soya yogurt, edamame beans, and tofu. Do try and avoid supplements that are not particularly good because of the fact that they have not been studied. So don't just, I have patients coming in with, spending 200-300 pounds every month taking various supplements because they've been told that these are the best ways. But remember that all these herbal medicines, unless they're actually in the form of herbs, they're in the form of tablets, so they've been ultra processed, and many of their healthy properties have been extracted. So you really want to try and stay away from most herbal medications unless you have a proper mark on it that it has been scientifically researched. Red clover, for example, has been. So avoid a reductionist approach by taking a number of supplements. Instead, focus on spending your money eating whole food, plant-based foods. Invest in a gym to do strength training initially with the help of a personal trainer who can guide you. Remember, there's a very complex interplay of ingredients in whole plant foods. And avail of sunshine, because most of my patients are low in vitamin D3, which is a hormone, and it does have huge impact on reproductive hormones. Also, if you're above the age of 50, or if you're on a plant exclusive diet, in fact, 40% of omnivores are vitamin B12 deficient. So make sure that if either you get your levels checked or you take a supplement. And also I recommend things like algae-derived omega-3 as well as iodine, because salt is not iodized in the UK, but also you don't want to have a lot of salt. So, and you don't want to really be taking calcium supplements in the menopause. There are suggestions that it might increase the risk of heart attacks, and fish oils often come loaded with mercury and lots of environmental pollutants. So if one is looking to manage hot flushes, whether you need HRT or not, make simple lifestyle changes. Turn the heating down, layer your clothes, keep hydrated, go for a swim, do strength training, lose weight even by 10% actually helps to reduce menopausal hot flush symptoms. Avoid alcohol and smoking, both of which can increase menopausal hot flushes. Try and find ways of doing hypnosis or meditation or yoga, and invest in eating foods that are colorful and rich in plants and rich in plant estrogens such as flaxseed powder, chia seed powder, and soya. Why am I going on so much about diet? Because we know that 1 in 7 of us will be diagnosed in our lifetime in the UK, and 1 in 4 breast cancer cases are actually preventable. 8 out of 10 women will have breast cancer in this country caused directly because of alcohol. And another 8 out of 10 will have breast cancer caused directly by carrying excess weight. While compare that to the pill or hormone replacement therapy, it's negligible. So it's really important to understand where you should focus your attention rather than getting worried when you actually do need hormone replacement therapy to improve your quality of life. And don't listen to people when they say that you can't, it's written in your stars. No, lifestyle trumps genetics, and the World Cancer Research Fund and the American Institute of Cancer Research and the Cancer Research UK all tell you to try and be a healthy body weight, be physically active, eat a diet that is rich in whole grains, vegetables, fruits, and beans, limit fast foods and animal foods and ultra processed foods, limit consumption of red meat and processed meat, limit consumption of caffeinated sugar containing beverages, limit alcohol, do not use supplements for cancer prevention, and follow these recommendations. Doesn't mean that you'll definitely avoid cancer, but you have a better chance of having a better outcome when you are trying to follow these, because remember that genetics loads the gun, but lifestyle pulls the trigger. So you can actually make a difference to your lifestyle. You can't change your genetics. And try and focus on foods that can actually have been proven to reduce the risk of cancer. So eat your greens, eat your beans, especially soya, eat your onions, mushrooms, berries, seeds, soya milk, flaxseed, green tea, turmeric. All these have been shown to reduce the cancer risk. And to reduce the risk of dementia, there is no different diet to reduce your menopausal symptoms. There's no different diet to reduce your perimenopausal symptoms or to reduce the risk of dementia or heart disease or cancer risk. So you do need to find your group, be active in your community, physical activity, eat the right sort of foods, avoid alcohol, look after your heart, because dementia is known as type 3 diabetes. So you really want to encompass as much of the lifestyle factors so you're reducing this risk, because none of us want to see out our lives in the last 10-15 years not recognizing our loved ones. So once again, to wrap up, remember that there are 6 lifestyle pillars, including sleep, reducing your risky substances, building a positive network, moving your body, reducing your stress, and eating foods that nourish you rather than hurt you. And it's never too early and never too late to make these small changes. You don't have to go 100% for anything. You can make little changes, and slowly you will find that without judgment, you have made big changes that you see a huge improvement in your life. Remember, there's no bad workouts. The only workout that is bad is the one that you didn't do. There is no bad diet. It's the only food that when you didn't eat, every time you choose to eat a donut instead of eating an apple, you're making that choice. So try and bring in foods that allow you to focus on color and be patient with yourself. Talk to yourself like you would talk to somebody who you love the most. Don't be harsh on yourself. Don't judge yourself. And remember that a portion is a handful. It's about 2 or 3 broccoli florets. So trying to eat 10 to 13 portions of fruit and veg daily is what is recommended by the guidelines, not in the UK, only 5. But in Canada and in Japan. And so that you would meet by eating 4 or 5 fruits, as well as a big salad or a big soup. So it's quite easy to do, but you don't have to start straight away with that. If you're somebody who doesn't eat fruit because you're scared of sugar, it's actually a myth, because the fruit contains the fiber. So you can eat as much fruit. Those who eat, the more fruit you eat, including mangoes and grapes and strawberries and all those fruits, the lower the risk of type 2 diabetes. And those who have diabetes and eat the most amount of fruit have the lowest risk of having one of the 3 major complications that kills diabetics. So things like amputations, blindness, and kidney failure. So do try, and every time you look on your plate, see if there is color on the plate, and bring in herbs and spices. It will make a big difference. And I want to also highlight that it's not just that you're eating for your own self. You're also eating so that you're compassionate to your grandchildren and children who you are leaving this beautiful planet to, which is being ravaged with forest fires, mainly because of animal agriculture, and also to help reduce the plight of animals and animal suffering. So you are really doing this not just for your own health, which is one of the most important reasons, but remember there are no healthy people on an unhealthy planet. And unless all of us make a little change, we are not going to be able to see ourselves through, and we will self-destruct very, very soon. So in summary, remember, perimenopause starts 2 to 8 years before the final menstrual period. Menopause is 12 months after you've had your last period, usually 51 years of age. Range can be between 45 and 55, which means that you can start having symptoms in your late 30s. Hot flushes are the commonest symptoms. It's important to assess for bone health and heart disease early. HRT is safe and effective for most people. Avoid bioidentical custom compounded hormones. Instead, go for the right type of HRT and avoid herbal supplements. Remember, a standard Western diet makes symptoms worse, while a plant-based diet helps to manage symptoms and reduce chronic diseases like diabetes, heart disease, and many cancers. Low fiber, high saturated diets make the typical British diet make symptoms worse, while when you add soya into your diet, you'll find many, many health benefits. And it's not about what you're giving up, it's all about the things that you're embracing. So I hope that you found this helpful. There are lots of resources both on my website as well as my daughter Rohini's website, and you may find both these books very helpful. But my website is free, and you can just go on to my website. I go around all over the world trying to educate school children and inner city populations to try and improve their health. And thank you. The book is available anywhere.
Thank you, Doctor. We had quite a few questions. Would you like me to summarize a few of them if you have
no,
a few minutes?
I can just go through them. So
we have 3 dietary questions.
Okay.
The first one is from Sam. She's asking, does soya yogurts like Alpro count as soya?
Yes, it does.
Yes.
So 100 grams or 80 grams of soya yogurt, a cup of soy milk will give you about 5 or 10 milligrams of isoflavones, and you need about 55. So you want to have another, a large handful of edamame beans, which you can buy frozen, and then you can put some lemon and chili flakes on it and enjoy it like a snack. I tend to have at least 4 portions of soya. So my diet tends to, because I do a lot of strength training, so I tend to have a handful of tofu every day or a handful of tempeh every day, edamame beans in my salad, and a cup of soy milk and a cup of soy yogurt. So that's what I would say. So yes, it does count, but you do want to try and have the more minimally processed. So tofu, tempeh, because they have a lot more fiber and things like that.
Okay, that's
But you
great.
want to swap. You don't want to have oat milk or almond milk or rice milk. Those are plant-based milks, and yes, they are better than dairy in many ways, but you want to always choose soya milk. Soya has got the best nutrition profile of all milks, whether it's dairy or other plant-based milk. So always choose soya wherever possible. You don't have to buy the organic version, because in the UK, none of it is genetically modified. And even if it was, it is not a big deal, but people get worried about genetically modified. All our food that we eat has been genetically modified for the last thousands of years. But it's important to understand that organic stops people from adding vitamin D and other nutrients to the soy milk. So I tend to recommend, the common brands, but with the non-organic version. And I tend to have that because it's got the right amounts, because I take a vitamin D supplement as well, but I also like to have it in my soya milk.
Okay. One more question. You spoke about rice as well. So Judith asked if white rice is a whole food.
No, it's refined. So white rice is not a whole food. Again, it depends upon the quantity. If you're out one day and you eat some white rice, it's not a big deal. If you're a child, then or an older person, then white rice might be the right thing, because you can people who are older, who have or are children and have small appetites, or athletes may get very full when you eat very high fiber red rice and brown rice. So in that situation, some Some white rice may be fine, or white pasta may be fine. So people who are playing Wimbledon, if they eat, for example, very high fiber foods just before, they can't metabolize it quickly enough. But for people, ordinary people like us, you want to go for the whole grains. So the quinoa, the red rice, the wild rice, the brown rice. You want to eat millet and amaranth and barley and all these different grains and experiment with them, and porridge oats and things like that, oat groats. I have lots of recipes again on my website and in the books. So
Okay.
I'm sure people will find it very helpful.
I'll leave the link one more time at the end as well. And then
Yeah.
one last question with regards to foods as well. Someone called Jay Spo is asking about salmon. And she also says, I've thought that eating less in the morning helps lower your insulin levels and gives your body time to heal.
No, those studies haven't been proven at all. In fact, for women, you should never do fasted exercise. You should always have something to eat before you exercise. And missing breakfast is never been shown to improve insulin resistance, especially in women, who are, hormonal health. So Dr. Stacy Sims, whoever asked this question, can dive into, she's done fantastic work, because most of the research has been done in men. And so for women, we are different. And so it's important to understand about the kisspeptin and the various neurons. And I discuss all that again in the book. But I would strongly recommend that intermittent fasting should be kept to 14 to 16 hours. And a larger breakfast and a larger lunch is preferable to a larger dinner. So that's important, unless you're doing a water fast, which is a whole different thing. You can do a 24-hour water fast if you're used to it. I'm used to it. So I've been doing it for the last 30 years. But it's something that needs to be done sometimes under supervision. What was the question about salmon you said?
We just got one word that said salmon.
Yeah,
so I assume she's asking about salmon in general.
Yeah, I mean, of all the animal foods, fish tends to be the better choice. Most people in the UK don't choose fish, but fish does tend to have a lot of, the bigger the fish, the more the contaminants in them. So if you eat very small fish, they tend to be better for you, because they have less, they're eating lower in the food chain. That is why cows and big tuna and all these tend to have more environmental pollutants, because they eat the smaller fish, who eat the smaller fish, who eat the smaller fish. So the bioaccumulation of all these hormones and chemical pollutants. So if you're going to eat fish and things, you want to eat the small fish, the minnow, the sardines and things like that.
Okay. We have one question with regards to symptoms. Lou asked about tiredness. I guess she only wrote tiredness. I guess she probably
tiredness is a real feature of perimenopause and menopause, but it should not just be assumed is because of that, because often 1 in 5 women will have extremely low iron levels because they have heavy periods and are often investigated for everything else except the fact that they're not realizing their periods have got so much heavier. And I see this every single day. So it's really, really important that, one doesn't assume that tiredness and fatigue is because of menopause or perimenopause, and proper tests are done, not hormone tests, but other tests. There was also a question, are dry fruits healthy? Yes, they are, of course, a concentrated source of calories. I would say. So if you're very athletic, then, dried fruits, you can eat a small handful. If you're somebody who's trying to lose weight, you're better off eating the fresh fruit, because you're having, but, overall dried fruits, dates and dried mango and things do have lots of fiber as well. And they add, so one of my favorite desserts, which I have every night, is half a pot of soy yogurt with a couple of dates chopped up, a handful of blueberries, 4 or 5 goji berries, and some cashew nuts. So it really depends upon, I walk about 30 to 35,000 steps a day. So as a result, I'm very physically active, as well as, so I need those calories. So one has to work out, do you have weight loss as a goal, or are you trying to just improve things? But I don't like people cutting out foods that actually bring them joy. And you don't need to eat animal foods to have protein. You can have a very balanced diet by eating healthy plant foods. But if you want to eat certain refined foods or ultra processed foods or animal foods, do them very mindfully. So when I eat a pizza on match day, I'm eating a vegan pizza because I know that that's what I want to do while I'm cheering England, but it's not something that I want to do on a regular basis. Do naps during the day mean you can lessen your nighttime sleep? Yes, if you want to. But sleeping more than 15 or 30 minutes has been shown to actually affect the nighttime sleep. And similarly, drinking coffee after noon can actually affect sleep quite a lot. Are all soya milks fine? It's just a question of finding one that works for you. I'm not allowed to mention brand, so I'm not going to. And then there was a question about red spots. Yes, they can occur as well. There can be all kinds of symptoms. Really, so many symptoms haven't been described. So it is possible. But again, make sure that it's not hay fever or a bite or a reaction to drugs. So I can't explain that, these are all diagnoses of exclusion. Don't just assume it's because of hormonal changes. Make sure that other aspects are looked at, because it's very easy to assume that. There was a question on breast cancer. I'm trying to find that. Yes. So somebody says that they're 58, they had a full hysterectomy and went into menopause, and which surgical menopause, where you remove the ovaries suddenly, is worse than going through natural menopause. Okay, so the symptoms can come on very quick, and many of the women are not allowed to take HRT. So what happens is, so she's saying that she has a whole host of symptoms, and as a result, they say the question is, have them in medical advances? Yes, neurokinin 3, or one of there is a newer drug that is being studied for breast cancer and hot flashes, but any discussion on HRT or these newer drugs has to be done with the specialist, whether it's the oncologist and the surgeon and a gynecologist. But soya in general is safe. But again, if you are hesitant about it, ask your doctors. The likelihood is most doctors are not knowledgeable about this area. So I would go on to the Cancer Research UK and things like that. But individual cases is different, but soya is safe. But whether you can do HRT or not, at this stage, that is something that only a discussion with your own doctors is possible. It's not, I can't give individualized advice without, all the information. I've been on Everil Sequi, which is a type of a patch, and I think I may be sensitive to progesterone. It's a discussion worth having, but the Mirena coil is a very good way of controlling periods as well as providing the progesterone arm of HRT. Again, I discussed this in quite detail. You don't have to stop taking the patch, and you can overlap it for a month or two. It's not a problem. Started having a dizzy spell and neck pain after starting Everil Sequi, which is a sequential patch, and I went to see a vestibular. They thought it could be HRT. Again, very difficult to give individualized advice. It's very unlikely to be a HRT, and I would definitely make sure that you have X-rays of your neck or MRI of your neck and things to make sure that you don't have cervical spondylosis and other things, and have your ears checked out like you did. And the only way is to have a trial and then stop it and then try it again and see whether that actually brings it back or not. Again, difficult for me to give proper advice. Are supplements worth taking? No. Most supplements are not worth taking, but things like evening primrose oil or starflower oil can help some women with breast tenderness and things, and so you can try it. But most other supplements, I have to say, are a waste of your money, and I would rather you spend it on eating berries and nuts and seeds and good quality herbs and spices. Have we gone through all the questions?
I believe so. Well, we have one more coming.
Okay. Now. Anything helpful for PMS? Yes, again, the more we know, lots of studies have shown that regular exercise and plant-based foods, especially a focus on herbs and spices, can really help with PMS. And the person with the PCOS question, there's a whole fact sheet on menopause and PCOS. There's a whole chapter in the PCOS book as well. So women with PCOS may find that their menopause is delayed by a couple of years. I don't know if you can see, that's the Living PCOS free book. It's all pretty reasonable. I don't make any money really from it. And this is the Finding Mean Menopause. But there are a lot of case studies, and most people find them very helpful. But as I said, if you don't want to buy a book, then my website has so many fact sheets that you can read. And my daughter's website, Rohini Bajekal, here. She's a nutritionist and a lifestyle medicine professional, and she has a weekly newsletter as well as lots of information on her website, which is completely free. So again, you might find that. And of course, if you're on social media, follow me on Instagram and TikTok. And whenever I feel like I add things that can educate people all over. Okay.
Thanks for joining us today, Dr. Bajekal, and providing so much information and resources with regards to perimenopause, menopause, and how lifestyle nutrition changes could prove beneficial. We would like to thank everyone who joined us today and remind you to check our practice website regularly for future updates and information about our following webinars. We hope you have a lovely start of the weekend, and we'll hopefully see you soon.
Thank you. Thank you. And thank you everybody for joining. Much appreciated. Thank you, Ines. Thank you, Jeff. Good night, everybody. Bye now.
Thank you.